For those of you who are unfamiliar with the MBPA, we have over 100 programs and 30 events and conferences we do each year, including the 101 Best and Brightest programs. We make our members' businesses better through business knowledge, financial savings, facilitated networking, and our legislative influence. And we will help get you through healthcare reform. Our programs positively influence over 150,000 businesses per year. So that is the breadth of who we touch. That's 1 out of every 3 businesses in the state of Michigan that our programs positively impact. So now I get to introduce Bonnie Bochniak. She's our Vice President of Government Relations. She's been instrumental in monitoring and lobbying on your behalf in Lansing as it relates to healthcare reform legislation and making sure you have the information you need as new things come out. And it is daily. We get emails daily, whether it's the federal or the state government, and it just burns and churns daily, and we're here to make sure that you have the latest, greatest information. So without further ado, here is Bonnie Bochniak.
Thank you, guys. Good morning. Well, welcome to the Affordable Care Act overview, a breakdown of the law and what Michigan's role is. So I'm going to introduce our panelists here. We have, I'm going to start with Don McAnelly. Thank you. Of Rehmann. Don is immediately to my right and your left. Don is the principal in charge of Rehmann's Saginaw office and leads the accounting firm and all of its health reform consulting for all of their offices. And next to Don is Rosemarie Day of Day Health Strategies. Rosemarie joins us today from Massachusetts, where she played an instrumental role in implementing the Massachusetts insurance model. Next to her, we have Chris Priest. He's from the Michigan Department of Health. Chris is the main liaison with the various state departments to implement reform for Michigan. He's somebody who I interact with very frequently in Lansing. Thank you for all of your help. Yep. And joining us all the way from Chicago is Larry Grudzien. Thank you. He's Polish. He's attorney at law. Larry is a legal guru and well-respected nationally as a premier health reform attorney. He is somebody we speak with on a daily basis as well. So thank you, everyone, for taking the time out of your very, very busy schedules. If they're not sleeping or eating or breathing, they are definitely absorbing and learning stuff to share with all of us here in healthcare reform. So how we're going to do this is we're going to start this session, and we're going to kick it off with 5 minutes for each panelist. I am going to start a timer just so we do keep everything on time here. And so, Rosemarie, if you can just kick it off for us, please, and give a general overview of health reform and its impact on business and a quick review of the MBPA timeline as you helped assist us get that together. Thank you very much.
Great. Good morning, everyone. It's a pleasure to be here. I have been working with Michigan for a couple years now, and particularly Massachusetts Business and Professional Association in the past year, and it's been my pleasure to kind of work with them through what have been the twists and turns of what's going on in Michigan. I'm not the expert on Michigan, though. I think he's sitting to my right, so what I'm going to do is just give you a few minutes of overview of what the Affordable Care Act is and isn't, kind of set that framework, and then the Michigan folks will take it from there. So the first thing I want to just note is that the Affordable Care Act, I'm afraid some people are going to start to think is a misnomer, because that first word, affordable, is, I think, that holy grail. We would all love health insurance to be more affordable, and there are some things in the Act that will hopefully get us there, but honestly, the Affordable Care Act is first and foremost about getting people coverage, and that's going to take a few forms. But it is very much focused on uninsured individuals, first and foremost, and trying to close that gap. As you may or may not know, in the U.S., we've got about an uninsurance rate of about 16%. That varies widely by state. Some states have 25% of people uninsured. Some may have like 10. But on average, it's around 15, 16%. And the Affordable Care Act is trying to close that gap. It won't get to zero. We didn't get to zero in Massachusetts. We're down at about 2% uninsured. I don't know that it'll even get to 2% because it's a big gap to close. But the idea is to bring more health insurance options to people and to try and make them affordable, but first and foremost, closing that gap of the uninsured. So while there are provisions for small businesses in the Affordable Care Act, and we'll certainly be spending a lot of time talking about those today, I do think that as we look at the rollout of exchanges and what their first priority is, they are very much going to be trying to get people who are uninsured today into some sort of insurance option that fits for them. So that's one of the kind of big number one points I wanted to make. And the Affordable Care Act is meant to do this through something I call shared responsibility. So it puts a requirement on individuals to carry health insurance. It also has requirements for government, frankly, to step up and provide subsidies for people who can't afford insurance, and also to regulate the insurance market differently than it is today. And finally, it does put some requirements on employers, which we'll be talking about a lot more today, which are kind of known as the pay or play provisions, as well as some other requirements. But the idea is that individuals, government, and employers all play a role in trying to close that gap of insurance coverage. And that was very much the hallmark of what the Massachusetts reform, which some people call Romney Care, was founded on, was very much shared responsibility, that government can't solve all this. Individuals need to step up, and so do businesses. So that's the theory of it anyway, and we'll certainly be talking more about that today. I want to touch on the insurance market reforms because that's a really big piece of what the Affordable Care Act is about. When we talk about getting people coverage, it's not just about trying to get them, more affordable insurance options or giving them subsidies to kind of close that gap. There's also been a lack of coverage in this country due to folks having something called pre-existing conditions. So if they had some kind of health issue and did not have insurance through their job, then a lot of folks in a lot of states could not actually get insurance coverage. And so the Affordable Care Act really changes the market rules across the entire country so that there's a guaranteed issue of insurance. I mention this because this truly, I think, is one of the fundamental pieces of the Affordable Care Act that I don't think is actually as well understood as hopefully it will be in the next couple years. And I mention it to you all as employers because this is really a game changer. If people are going to be guaranteed coverage whether or not they have insurance through their employer, that starts to kind of change the dynamic. It doesn't make insurance necessarily affordable. Again, an employer subsidy is worth an awful lot to folks, but a lot of people did hang on to jobs because they could hang on to that insurance if they had a pre-existing condition, and that is going to change come 2014 in every single state. The last thing I'll talk about is exchanges, and I think you've heard a lot about exchanges, and Chris will talk about kind of where we are in Michigan with that. But exchanges are essentially a marketplace, and the Affordable Care Act has put out a framework for all states to have an exchange, and if the state doesn't do it, then the federal government will run it for the state. And that's to put a whole bunch of insurance products into an online kind of forum that you can go and make hopefully a simple comparison, apples to apples, whether you're an individual or an employer. There will be public exchanges, but there will also be private exchanges, and I think that's something you're going to start hearing more about as private companies look for alternatives to provide for small employers. Again, going back to what I said, where the public exchanges are going to have an awful lot of work to do just to get the uninsured individuals covered. I do think they're going to not be able to put their priority attention onto what they're doing for small businesses. So there will be other kinds of solutions, places to buy insurance that will emerge. So I would say because of all these changes, you're probably thinking about this, but employers generally, whether they're small or large, are all thinking about what 2014 brings and whether they should change what they're doing. They're basically, employers are going through this exercise now, reevaluating what they're doing for coverage, what it means, for their individual employees. I don't see wholesale changes being made come, January 1st, 2014, because I think there's been such a long period of people not really believing this law was going to get implemented, and now kind of suddenly it's upon us. I don't think we're going to see overnight changes, but I do know that the employer community, again, from small to large, is really trying to kind of analyze this, evaluate options, and start to think about the future.
Thank you very much, Rosemarie. Great. Larry, if you can give a general overview on the employer mandates, your favorite topics here, layman's terms for an audience that needs the basics, please.
Thank you. Starting January 1st, 2014, any employer that's considered a large employer is required to offer coverage to their employees. What is a large employer? A large employer is any employer that employs the previous calendar year 50 or more full-time equivalent employees. What does that mean? Basically, an employer has to go through a calculation considering all employees in that calculation, both full-time and part-time. And basically, what an employer has to do is look at the part-time hours each month, divide that figure by the hours by 120 to come up with a full-time equivalency. If the combination of full-time and full-time equivalent employees reaches 50 or more, then the employer is required to offer employees affordable minimum essential coverage. Now, what does that mean? It means that coverage must not exceed 9.5% of the employee's income. And the statute says household income, but nobody knows that. So we're basing it on W-2 or the wage rate. Minimum essential coverage means the plan must cover at least 60% of the expenses under the plan. Now, if an employer, there's two ways an employer can be penalized under the Affordable Care Act. If an employer decides not to offer coverage, the penalty is $2,000 times the number of full-time employees minus the first 30. All right? So if you as an employer decided not to offer any coverage at all, that would be your penalty. In talking to many employers are considering dropping coverage and paying the penalty starting in 2014. That's a consideration. The problem with that is, especially if you're an employer with a lot of part-time employees, or employees that are younger that may not take your coverage, remember, by paying the penalty on all employees minus the first 30, you're paying a penalty on people that may never take your coverage. Now, you're going to be penalized if any of your employees goes on the exchange and gets a credit and subsidy. So if one of your employees goes on the exchange and you not offer insurance, that's when you're going to be penalized. The second way that you could be penalized is the fact that you offer coverage and it's found to be not affordable or not minimal essential coverage. And again, that's that 9.5% figure. That penalty is $3,000, but it's only $3,000 for any employee who goes on the exchange. Now, in 2013, please remember that the most important thing you can do as an employer to get ready for this, especially if you're an employer that employs a lot of part-time people, which of your part-time people will be considered to be full-time? And a full-time employee for this purpose is anyone who works 30 hours or more. Now, what the IRS has done, they've come up with some safe harbors as you can go through, and these rules are extremely complicated. There's a measurement period and a stability period that you have to go through to see exactly whether any of your full-time people are any of your part-time people are full-time. Now, your obligation as an employer is to offer affordable coverage to your employees and their dependents. The 9.5% figure, though, only applies to single coverage, but you have to offer coverage, all right, to the dependents, but you as an employer, you are not required to pay for it, all right? And what's also very interesting, when the IRS came out with guidance in December of 2012, what they indicated was that you're not required to offer any coverage to the spouse. The spouse, for this purpose, is not considered to be a dependent. Very, very interesting. So as a result of this, as an employer, what you have to think about is changing your strategy, because many employers pay for employee coverage plus dependent coverage. They pay a good portion of that. Also, most employer coverages in existence right now is way beyond the 60% figure. So what you may want to consider in 2014 is talking to your broker and say, under healthcare reform, I want to comply, but with the cheapest coverage possible, and get down to that 60% figure. So the rules have changed starting in 2014. Now, one other item which is very, very interesting. The law is in effect as of January 1st, 2014. But the IRS has indicated there's a special transitional rule that says this: if you offered coverage to 1/3 of your employees, or covered at least 1/4 of your employees, you can wait, and that was as of December 27, 2012, you can wait until your first renewal in 2014 to actually comply with healthcare reform. So they give you a little bit of time to comply with with the law in 2014. But again, this area is very complicated. I just summarized something in 5 minutes that I have a seminar that goes on for an hour and a half.
Well, Larry, thank you. We'll get back to you. I know there's going to be a lot of questions for you. Thank you so much. Chris, you're up next. If you can give us a general overview of the status of the Michigan government and its actions for implementing reform. It's a loaded question. Ensure the exchanges discussed and touch briefly on the expansion of Medicaid.
Sure. I think you all really need to appreciate that was awesome.
Yeah.
Like, I mean, seriously, like.
And it was all made up.
Yeah, I mean, if you can't tell, this is not at all complicated. So this is one of those things I got mad props.
Yeah.
All right. So what's happening in Michigan today? So back in 2011, well, let me back up. So like Rosemarie said, every state has to have an insurance exchange. There's going to be a public insurance exchange offered in every state, and there really are two options. It's either controlled by the state, or it's controlled by the federal government. In Michigan, we had originally proposed creating a state-based exchange. We wanted to create a new nonprofit corporation to have kind of a lean but not mean organization that can better provide service to our consumers, which is Michigan residents. We had worked with the legislature. We called it My Health Marketplace. We had worked with the legislature, and we had legislation that passed the Senate, but it did not pass. It did not pass the House. Fast forward. So at that point, it's kind of like, all right, well, the federal government's basically going to be controlling something in the state of Michigan. We had then came back and proposed that, you know, there are a couple really key things that the federal government is just not really good at. And we know that a lot of Michiganders are going to have questions, or they're going to have concerns. They're going to want to talk to Michiganders about a lot of their options, you know, especially in the employer community. I mean, you know, a lot of insurance agents and other folks really are valued resources to the business community, especially. And we wanted to try to facilitate a way to make that engagement a lot easier. So we had proposed what is commonly known in the healthcare world as a partnership exchange. Essentially, it's a federally controlled thing. The vast majority of functions the federal government is running, but there are a couple of places where we could really play. Well, now we are at a point where the legislature has not given us the spending authority to use federal resources to support those activities. So as a result, the exchange that is implemented in Michigan will be fully federally controlled. So what does that mean? I mean, honestly, is there a giant difference between it? And I would say that there are a couple real differences. The first is operationally, I mean, this is going to be kind of a federal one-size-fits-all entity that Michigan residents are going to be working with in about our state and about 32 others. It is not going to be tailored for our unique needs. We think that is, and that's why we had originally pushed a state-based exchange. The exchange also will, all the consumer assistance functions will also be federally controlled. So quite honestly, if someone wants to not use the website, they will literally have to call a federal hotline in order to help get answers.
One number, you call up and it's going to say, there's 250,000 people ahead of you, there's a 6-day wait.
Press 18 for Michigan. There are, that's actually not how it'll work. I actually was with the feds last week and it actually doesn't work like that, but still, it kind of scares you a little bit because, I mean, you're going to have a lot of Michigan residents, some of who are buying insurance for the first time and don't really understand how complicated it is, and calling to this federal hotline asking for information. So I think that's another issue. And the third issue I think that's really complicated is cost. the federal government is going to charge 3.5% of every premium sold on the exchange. So every health plan that's offered on the exchange is going to be charged a user fee, if you will, of 3.5% of the premium that's offered. Well, that increased costs. And if we had a state-based exchange, we could have made that cost smaller. If you look at a state like Colorado that's doing their own state-based exchange, their user fee is 1.4%. So we are going to see a little bit of a higher cost in Michigan as a result of this decision. But it is what it is. So right now we're moving forward. We're working with the federal government still. The process for health plans to offer on the exchange has started. So they are now starting to come into the insurance commissioner's office and start to file their applications. We have obligations under the insurance code to do a lot of what's known as plan management. So we are performing some of those things, and we will load those onto the federal exchange. But then after that, really, it's federally controlled. So that's kind of where we are on the exchange side. But on the Medicaid, there's another key question, and it really does impact business.
Like 30 seconds.
Okay, so Medicaid. A lot of folks think Medicaid, and you think it doesn't really impact the business community that much, but actually it has a huge impact, and here's why. If we don't expand Medicaid, the way that the Affordable Care Act works, a lot of these folks, a portion of these folks, will end up going into the exchange, and these folks are sicker, and in insurance, it's all about risk. So what does that do? That actually increase costs on the private sector and in the private markets. If we don't expand Medicaid, that premium increase will be realized across the spectrum. And it is very real. Not only that, it's the right thing to do. We have estimated that it provides significant savings to the state budget, and you ensure that you have a whole lot of Michiganders, I think it's something like 320,000 Michiganders, who end up getting additional coverage. So you keep private insurance down, you cover more people, and you end up saving money in the state budget. I mean, it's a win-win-win. So we have proposed that, and we're currently working with the legislature on it, but that's where we are. Sorry to take time.
No, thank you. I'm sure we'll get back to that issue again. And then, Don, if you could, as brief as you can, tax credits, penalties, and the full-time employee information, please.
Sure. There's a lot of issues out there. I suspect most of you in the audience are probably people who manage people within your businesses. Maybe some of you have been teachers, maybe some of you have been coaches before. One of the tenets about doing some of those things is motivating people. And within the Act, I believe that one of the first tax credits that came out was the small employer health insurance credit. And that was meant to try to incent smaller employers out there. This came out in 2010. It was employers who had less than 25 employees, so these are smaller employers, paid average wages of less than $50,000 a year. Okay, and at least paid half of the insurance premium. That was one of the first tax credits that came out. It was meant to be a carrot, if you will, to help smaller employers, to encourage them to provide health insurance to their employees. They were able to get a tax credit of up to 35% of the premiums that they paid. Now, in actuality, as a CPA in practice, I've not seen this be a real significant thing for many of our clients. And I think there's probably a variety of reasons for that. One of the reasons is that maybe these types of employers that are maybe have lower compensated employees, really the market doesn't demand benefits for those types of people. So we really haven't seen, in my opinion, I haven't noticed a lot of people, a lot of businesses accessing that credit, receiving that benefit. There's two phases to that credit as well. The first one was 2010 through 2013, so we're in that first phase. The second one begins in 2014 and beyond. It's a 50% credit there. So those of you that are smaller employers that maybe have employees that are a little bit lower compensated, you want to make sure you're taking a look at this credit. It helps to provide some of the health insurance there. The way the Act is really structured is that there's credits on both the individual side and the business side, okay? And we just talked about some of the business ones just a minute ago. On the individual side, what you're going to see, as my colleagues up here have talked about with the formation of the healthcare exchanges, the marketplace, if you will, you're going to see some credits that are out there for people that are going to shop on the exchange. They're going to be able to get, if your income level is $133,000 to to 400% of the federal poverty level, you're going to be eligible for credits. So when people are out there on the exchange, on the internet exchanges, they're going to be able to access their insurance. They're going to put in some of their private information. They're going to determine at that point in time how much of a credit that they're able to get. That's called a premium subsidy. Okay, and there's also a cost sharing credit that's out there, though. That's out there in addition to that. And that is for people who have incomes up to 250% of the poverty level. So if someone were to buy a policy and they're metal tiered, maybe you've heard bronze, silver, gold, and platinum. You guys heard anything about those? I'm seeing some head shakes, so that's out there. They're metal tiered, and so, bronze is supposed to cover 60% of the actuarially determined costs. Okay, so if someone who has lower income levels obtains this insurance, they could get a premium credit, and if they're below 250% of the federal poverty level, then they're going to get a cost-sharing credit. So, to the extent that maybe they have some co-pays and deductibles, they're going to be eligible to get reimbursed for those. So those are kind of some of the credits that are out there right now in terms of the business, and credits that will be out there soon in terms of individuals. With also there being a carrot, we also know that one of the motivations is what? A stick, right? Okay, and the act is an individual mandate, and I think anyone up on this table would tell you that really the act doesn't require any business to provide health insurance. Really, there's an individual mandate out there. The business requirement with over 50 is the shared responsibility, the play, as Rosemarie and Larry and Chris mentioned, that are out there right now. And what the act says in 2014, some of the penalties that are going to come out there, first thing on the individual side, okay, so if an individual does not have adequate coverage, and they don't get it from their employer off the exchange, they're going to have a penalty of the greater of 1% of their adjusted gross income, or $95 per person. Doesn't sound like a huge penalty. In 2015, it increases to the greater of 3% of your adjusted gross income, or $325 a person. And then in 16, it goes up to 2.5%, or $695 per person. And it's indexed after that. There is a cap on family coverage at 300% of what the single coverage would be, or the single penalty would be out there. So, the stick is out there in 14 and beyond when the individual mandate comes up that people, if they don't have their coverage, they're going to have to, if they don't, they're then going to have to pay a penalty. On the business side, I think Larry touched upon this, and so did Rosemarie in their few minutes of presentation. There are penalties that are going to come out there in the form of a play or pay penalties, okay? And there's going to be penalties of either $2,000 or $3,000, depending upon the level of coverage that you have, and if you don't provide coverage at all. So that's going to be in 2014. I think a lot of my brethren are concerned that come 2014, 15, and beyond, there's going to be a lot of reporting that's going to need to be done regarding who has coverage, who doesn't have coverage, as the IRS is probably going to send out some love letters to people letting them know that you might owe some money. And I think there's going to be somewhat of a cottage industry that I don't think these letters are going to be 100% accurate. So it's going to be
It's a good assumption.
It's going to be an interesting time. So.
Well, Don, thank you very much. This concludes a brief overview, and now this is the fun part, is questions. Do we have?
Can I make a comment for a second?
Oh, sure. Go ahead, Larry.
One thing to just consider if you're going to urge your employees to go on the exchange. I looked at the application for the exchange. It's 22 pages. So if any of your employees have a hard time filling out a 4-page application, just imagine the fun for a 22-page application.
All right.
Hold on. To be fair. Well, yes, in paper it is a 22-page application. That is correct. But if you're utilizing the website, it is a little bit like, I would compare it to TurboTax. I mean, it is a little bit more user-friendly than that. That being said, oh yeah, they're asking for a lot of info. But it's proposed. They're still working through that. But I don't think that should be an alarmist point of perspective on that. I know.
Right, and I would just say a lot of those pages have to do with whether you're trying to figure out if you qualify for a subsidy. If you're somebody who doesn't need a subsidy, you fast forward through a lot of those pages. So,
Thank you, guys. I can see this is going to be fun. All right, question number 1.
Hi, my name's Nathan Hogue. My question is for Larry. I don't know if you want to get this in depth right now or not, but you were talking about measurement periods and stability periods for part-time and seasonal workers working over 120 days per year. I don't understand. I know the measurement period's anywhere from 3 to 12 months. The stability period is a minimum of 6 months. And my question is, for people that work, say, it comes out that they work full-time in about 4.5 months a year, okay? So they're going to have to be offered 6 months of coverage. And I know that the measurement period starts their first day that they start working at that 4.5 months. So are they going to have coverage that 8 months that they're not working until the next, you know, how maybe 8 months might pass till they work again? Are they going to have coverage in that time?
I bet you lost a whole crowd there. What he's talking about basically, if you are an employer with part-time employees or seasonal employees, what you have to do is you have to determine a measurement period of 3 to 12 months. Now, generally, full-time employees have to be covered after 90 days. They have to be eligible the 91st day. The exception to that is going to be part-time and seasonal employee. And as an employer, what you do is you determine which measurement period is best for you. And during that measurement period, and this is important, they receive no coverage. And if they work on average 30 hours during that measurement period, only after that, during what's called a stability period, do you offer them coverage. Now, for many of you who have seasonal employees, what's going to happen is you have to measure them, and they are deemed to be full-time during that measurement period, and then they leave, and they come back the beginning of the next year. If they're determined to be full-time, what you have to do is when they return, you have to offer them coverage, all right? And you have to offer them coverage during the stability period, even if their hours dip below 30, which is going to be a very interesting exercise for many employers, trying to get that money off of the employees when they dip down to 5, 10, 15 hours a week. So that's going to be a real challenge. But again, this is an exception. And for those of you who have part-time, this is the most important thing you can do in 2013 is determine how many of your part-time employees are actually working full-time, which is 30 hours a week.
To Larry's point, before I move on to the next question, is I'm going to be reviewing this at the end, is our Healthcare Connect reform website, and we have a full-time employee calculator on there. We also have the small business tax credit calculator. So I want to point that out now, since it is we're chatting about it, so I can reference that when we go about similar questions. Thank you. Next question, please.
Amar Iqbal. 2 questions. One is, you gave a good overview about how the health exchange and some comparables with Colorado and Massachusetts. How does Michigan, number one, rank? Where are we on that threshold compared to other states? Because will that impact our ability to attract talent if we're behind the curve? And number 2, will this also, I mean, right now, most employers, it's a one-size-fits-all, here's the policy, especially for small businesses, the health options, or there might be 2 or 3. Will this open up that an employee could say, hey, you know what, I want this level of coverage, and they pay the difference, or how does that is expected to work?
So that's actually a very timely and fascinating question. They are, so let me ask the first question. Their first question was about, kind of where are we on like a ranking? It's kind of black and white. If you're in a state-based exchange, you really have a lot more discretion to kind of, what you're going to charge and things like that. Really, because we're in a federal exchange, we're lumped in with about 33 other states. Every one of the states that are in a federal exchange is going to have that same thing. So in terms of deterring, economic development or anything like that, I don't really see that compared to our partners. If you look at the region around us, all of our regional counterparts are also participating in a federal exchange. So regionally, we're all in the same boat. The second part is an interesting question. So there is a part of the exchange for the small business side, because remember, an exchange is two things. There's the individual market, and then there's a small group market. So in the small group market, there is something that is known as employee free choice, where employers have some flexibility to go into the exchange and pick multiple plans or they can basically decide for their employee to kind of pick what you want, here's a defined contribution, go about your merry way. In a federal exchange, that feature will, as of last week, right? As of last week, will not be possible. So essentially, if you're going to use the federal exchange to shop for your employees, you would basically pick kind of the same model today. You pick a benefit package for folks to offer and for folks to see. So that is, and I think this is just the beginning of kind of what we're seeing. Rosemarie and I were talking about this before. This is kind of the first thing that you're seeing the federal government start to shuttle feature, and I think that no one really knows exactly how this thing is being prepared. I mean, really, it's amazing how well these guys keep secrets. It's like the CIA can't keep secrets as well. But they have, I think we're just starting to see some of those features that are supposed to be part of the package. You might see them start to get delayed a little bit more, and that's a classic and very recent example.
One other point I just want to make, and this is for employers. One thing you want to protect yourself in the fall of 2013, if and when the exchanges are up and running, there's a series of questions on the application about employer coverage. And what you may want to do in around that time is have someone look at the application and give your employees the answers to those questions, because if the employees get the questions wrong, and they indicate to you that, they indicate to the exchange that your coverages are not affordable because they don't understand the language, and all of a sudden you're going to get a friendly letter both from the IRS and from the HHS indicating that, hey, your employee said this, and therefore you may be penalized. The best way to avoid that letter coming to you is saying to your employees, we've looked at the questions on the exchange, and because of our coverage, this is how you should answer those questions. Therefore, you're going to avoid most of the traffic from those various governmental agencies.
That's a great tip. Next question, please.
Yeah, good morning. My name is Alan Sefton. I'm just curious, you had talked about the Medicaid issue earlier. Right now, I'm an agent, and right now, clients are paying that 1% tax, which I understand is not doing what it's supposed to, and there's potentially an increase, going to be an increase in that tax.
You're talking about the claims tax?
Yeah, the claims tax. Do we know where that's going? Is it going to be continued? What's happening with that being right now? Everyone's paying that tax, and what happens going forward into 2014?
So that's something we're continuing to work with the legislature on right now. There is an expiration date on it, and it is coming very soon. It is a support mechanism to help support the existing Medicaid program. The Medicaid expansion itself is 100% federally financed for the first 3 years. So that is kind of, and the way that when the Supreme Court ruling came down, really the expansion question it's a separate thing. In terms of the claims tax, that's something we're working with the legislature on right now. I can't give you a guarantee one way or the other right now because it's something that we're working through. But we do feel that it's a critical thing for the existing Medicaid population to be able to support that.
Thank you. Next, we have several questions over here, too. Thanks, Melissa. Just to interject while Melissa's walking over, I know MBPA were lobbying against they want to make it a variable tax, and so we're trying to work pretty hard to keep it at that 1% and not to have it a variable rate every year, so you know what liabilities you have every year. Thanks.
Mine is a simple question. There's 30 million people that don't have insurance, right? So supposedly, how is a $95 penalty going to get 29.9 million people to take insurance? Why wouldn't I just not have any insurance because it's going to be guaranteed issue in 2014, and then when I have an illness I have to take care of, then go out and buy insurance at that particular time?
So I'll try to take that one because we, in Massachusetts, had the framework for this law first and included an individual, a penalty that was implemented through a tax penalty through our own state Department of Revenue. And people had that very same question. First of all, the 95 is small to begin with, as Don talked about, it goes up to $695. But the idea, I think, the philosophy is that you didn't want the penalty to be overly punitive. It should never be the same price as actually buying insurance. It needs to be enough to kind of get people's attention, but not, again, be overly punitive. And it turns out when you do research, there are a lot of people who will, because they'll understand it's the law to get insurance, kind of regardless of the math of it. There will be some people, not everybody, but there are people who comply just because it's the law. So you'll see some take up for that. You'll see some take up just because now the rules around guaranteed issue mean that there's access, and you'll see a lot of take up thanks to the subsidies. So like I said, you won't get to reducing that 30 million down to zero. There will still be a lot of people uninsured because there will be those who say, I don't care what the law says. They'll play the opposite side, but you start to close the gap with the combination of carrots and sticks, and we did see that very much in Massachusetts.
I think the second issue, probably Obama administration was in a box because the fact that if it was too onerous, probably there would have been constitutional issues if it was deemed to be a penalty as opposed to a tax. The state has power in regard to that, but the federal government does not, and that's what they were facing in that situation.
And in terms of people jumping on insurance coverage when they get sick, I mean, a lot of that would if that was to happen, when someone gets sick, they're paying a lot of bills. And there is an open enrollment period on the exchange to help incentivize against that. So basically, if you don't come in under a certain window, you can't, you're not supposed to be able to.
Can't for the whole
Similar
year.
to Medicare. Similar.
Yeah, it's very similar to the way Part D and other things work.
And in Massachusetts, we didn't start with the open enrollment period, so we did see some of what you're talking about, and then within 2 years, the legislature closed that loophole and the insurers were much happier.
I see a lot of abuse of when that starts car insurance. You can go get that insurance to get a license. A person would buy insurance for a month and then cancel the coverage and then drive without the insurance. I see a lot of that abuse in the area.
Oh.
Hi, my question is because we are a restaurant that employs a fair share of high school 16, 17, 18-year-olds, and in figuring the FTEs, some of these kids are covered by their parents. Some of them, the parents may want to drop it under this thing. Some of what we've heard in previous discussions, not here, makes us think that if they use their parents' coverage, we will be penalized. I'm just wondering how this is going to be handled.
In this situation, if the only time you have to offer those part-timers any coverage at all is when they elevate their hours to full-time. And if you use a 12-month measurement period, that's 1,560 hours. That's a lot of time. Now, your only responsibility in 2014 is to offer coverage to those employees. They don't have to take it. And the most important, another important form in 2014 is going to be the waiver form. Evidence you've actually offered coverage to your employees. And again, for many part-timers, even if they're elevated to full-time, they work that many hours, many of them won't take it because they can't afford it. And even though the premium cannot exceed 9.5% of their income, for many of them, that's a lot of money. So they're not going to take the coverage. And in talking to many industries with many part-time people that may work full-time, they're figuring maybe less than half will actually take the coverage. Okay?
Next question.
Hi, I have a two-part question going back to the SHOP and defined contribution. First of all, I was under the impression as of last week that the SHOP is postponed indefinitely. Second of all, assuming that it does show up eventually, how does it work as far as defined contribution post-tax versus pre-tax? Because right now, they're not allowed to do that as a pre-tax, because then essentially they're an individual, not a group.
You want to do the pre-tax,
How does that work?
post-tax thing, or do you? I can't hear. On SHOP itself being delayed, that is not true. The part that is being delayed is the free choice component of that. You will still have the ability to go to, as a small business, employees, up to 50 basically in Michigan, to go to the exchange and get a 50% tax credit for your contribution towards the cost of health care. on the exchange. Now, the problem is that, like this gentleman was talking about over here, is there isn't exactly going to be a wide array of choices that the functionality isn't going to be there to offer the wide array of choices that were originally envisioned under the Act. So it's just that functionality piece that's being delayed until 15. The shop itself is going to be up and running, and there are obligations by the federal government to do that.
Let me just add, the exchange should have a wide variety of choices. That's the goal of the feds. But you as an employer would go in probably similar to what you do today and just say, I'm going to pick, Blue Cross Blue Shield Silver X plan, and that's what all my employees are getting. So you, the employer, would look at a big array of choices, but you pick one for all your employees. The kind of cool feature that is being postponed for however long is your employees could have gone in and chosen, well, I like Humana, no, I like Blue Cross, I like this, I like that. You would have given them this defined contribution and they buy whatever they want. It's complicated, it turns out, to administer. That's why it's being postponed.
You can. I mean, this is only if you're going to utilize the shop. Nothing is changing to say that employers have to use the exchange. They're the same way with individuals. Now, if you want to take advantage of the tax credits that are available through the exchange,
that's the only place to get them.
That's the only place to get them. But if you don't, there is nothing stopping you from doing exactly what you're doing today outside of the exchange. There isn't.
Now, for any of you that are a smaller employer, one thing that's raging out there is, remember in 2014, if your plan is not grandfathered, the most important change for small employers is that every non-grandfathered plan in the country would be community rated, all right? Which means that your renewal is not going to be based on your experience. So in the future, if you had in the past, if you had really good experience, your premiums will probably go up. If your experience was bad in the future, your premiums will also go up, but not as much. So community rating has some positives and it has some negatives.
Yeah, and there'll be lesser of an impact in Michigan as that relates, because we had a lot of those reforms already baked into our insurance markets. So I think that some of that's already factored in. I mean, I think the biggest changes we're going to see on the individual and small group markets, quite frankly, are really going to be on the individual side. And that's because the benefits afforded under the Affordable Care Act increase significantly. Just to give you an example, in the individual market, less than 50%, less than 40%, I think actually, of plans today offer inpatient maternity benefits. So now that's a requirement under the Affordable Care Act. So going back to some of the costs, the affordable question, you are going to see a lot of costs kind of built up. That's because there's going to be richer benefit packages for individuals to purchase on the exchange. And then there are tax credits through the exchange to help make that work.
Thank you, Chris. Sorry, we have two more questions, and we're gonna have to make them kind of quick. We do have another group coming in after this presentation. Please remember, though, that we're all available. These folks will be around for a short time, and then we can connect you. We can connect with us. We can have a lot of your questions answered that maybe we couldn't get to right now. And they're available at lunch as well. So next question.
Hello, Kathy Cooper. My question relates to, there are a lot of small group employers that are out there trying to avoid these new rules. And one of the strategies is changing their renewal date to December 2013. And we understand that plan year ties back to the ERISA definition. So in your opinion, if a small employer under 50 has a summary plan description that is modified to say that their plan year is December 1st, 2013, could they legally avoid these rules until December 2014?
Until we get further guidance, I don't see any problem with that, but you just have to do it properly. And again, the reason why some employers are doing that is the community rating in some states, but I don't see any problem in doing that. Now, if you're a large employer, the problem is, and if you don't meet the transitional rule, it's January 1st, 2014. You can't change that. Go ahead.
No, that's right.
Yeah. So, so for small employers, absolutely. Now, the biggest challenge for small employers is trying to decide in 2014, is it advantageous for me to drop coverage? Because if I offer my employees affordable coverage and they go on the exchange, they can't get any credits and subsidies. But if I drop coverage, the government's going to pay me the government's going to pay them to get insurance, especially if they're lower income. So therefore, should I pay for insurance or should the government pay for the insurance for the employees? The problem I see in 2014 is that at first, even if the exchanges are up and running, the first year is going to be extremely chaotic because they've indicated, HHS has indicated that it's going to be a stripped down version of the exchange. So we don't know what's going to be there and what's not going to be there, but it's not going to be pretty.
I think Larry's hit upon a really important part, and that's the whole planning aspect of this whole thing.
Right.
That businesses really do need to start to plan for this immediately to, with this measurement periods to best understand how the act's going to impact you.
Yeah.
So
And it
one-
really is an individual decision. I mean, it's not like you can kind of put everything in a broad stroke because every business is unique. So it really is incumbent on y'all to really say, all right, how does this work for my employees? What's the value proposition for me as a, retaining talent? There's a lot of things that go in there.
And one last question before I move on.
Related to the last point, if you are a small employer that offers insurance to your employees, and they tend to be not highly compensated, and it is cheaper for them to go to the exchange themselves than paying their percentage through you, will you be penalized as the employer if you offer it and they still say, well, it's going to save me $500, $600, $700 a year to get it through the exchange because the government's going to subsidize me?
Yeah, if you're a small employer, there's no penalties. Now, what you have to watch, especially if you're close to 50, because it's the determination of a large employer is always done in the previous calendar year. So if you're getting close to 50, you always have to check and see, especially with your part-timers, whether you're going to go above 50. That's going to be the most important determination. But if you're like 15 or 20 employees and you don't see you're going to add anybody for years and there's no penalties, you just have to decide whether in your community is it advantageous for you to offer coverage to those employees or drop coverage. That's going to be an important determination.
Taking a look at those variable time employees, the Act calls them variable time employees, is really a key component of all this. Because I'm working with a client of mine who has 35 full-time people and they use a lot of part-timers. And they first thought this Act is not really applicable to them. Then we started to analyze their variable time employees, and lo and behold, we found out they had 51.3 FTEs. But at least now we're in the measurement period, we can begin to manage around that if they want to be deemed to be a smaller employer, so they can somehow manage their business a little bit more.
If you guys could, on the panel, really, really briefly leave the audience with one real quick tip. If each of you can just say just your prized possession that you want to offer to the audience that they take away.
Run.
Plan and plan now.
I would say use the MBPA tools to aid your planning.
Yeah, thanks.
We're in the measurement period right now, and not a lot of employers really know that. I think it's become educated regarding what the measurement period means and begin to analyze your employee base so you really can understand what the potential impacts to your business will be.
No, seriously, what you should do, you have time to plan. Talk to your accountant, talk to your broker, and plan right now because they will help you determine what the impact of this law is.